Hello, my name is Nancy Santiago and today I will be discussing San Mateo County's health profile. I hope after this presentation you will have more knowledge and interest in the county just as I do. I want to start off by saying that Healthy People 2020 continues to highlight the importance of the social determinants of health. The social determinants of health refers to an individual's social and community context, education, economic stability, neighborhood and built environment, and lastly, health and healthcare. Together, all these factors help determine what possible outcomes communities can expect to experience. For this reason, health outcomes will vary from region to region as environment and resources change. It is essential to understand all underlying factors to do a in-depth report on its multiple factors. Such factors include the general demographics of the place where they live, the socioeconomic status, health clinics and insurance available, the mental health services provided in the county, health behaviors, and nutrition and food insecurity. After analyzing all these contributing factors and determining what San Mateo County's most significant health issue is, then there can be an attempt to find possible recommendations and solutions to the region's concerns. San Mateo County is approximately 20 miles south from San Francisco and 30 miles northwest of San Jose. San Mateo County was founded from what was then the southern region of San Francisco and was founded in April 1856 with less than 5,000 residents at the time. San Mateo County consists of 20 cities, of which Daly City is the largest in population. Its estimated population for the county as of July 1st, 2019, according to the U.S. Census Bureau, is that there is 766,573 residents, which is an increase of 6.7% new residents from 2010 to 2019. Divided by race, the population consists of 60% white, 2.7% African American, less than 1% American Indian or Alaska Native, 1.5% Native Hawaiian or Pacific Islander, 30.1% Asian, 24.3% Hispanic or Latino, and 4.7% belong to two races or more. The age range of their population falls mainly between 19 to 65 years of age, and over an eighth of the population is 65 years old or older, which is higher than the state's average, which is only 14.3%. It is estimated that by 2030, nearly 24% of its population will be 65 or older. This aged population is above average when compared to the rest of the state, meaning their healthcare demands will increase. As for sex, there is approximately an equivalent amount of males versus females, with 50.6% females in this county. Access to healthcare is most times determined by socioeconomic status. Therefore, it is essential to keep this in mind when measuring access to healthcare. Within San Mateo County, there are about 279,457 housing units, with each serving an average family household composed of 2.89 people. An estimated almost 60% of homes are owner-occupied, which is more than California's average, standing at 54.6%. The median income of families in this county from 2016 to 2018, according to the U.S. Census Bureau, was $113,776, while in the rest of California, the average is $71,228. In San Mateo County, 6.8% of families are in poverty, which is relatively low in comparison to the state. San Mateo's child poverty rates are at 21%, which means there is room for improvement to get families to a better socioeconomic status. Lack of access to health care will aggravate health concerns. That's why it's vital for everyone's demands for access to health care to be met. Some working residents can receive health insurance through their employers, but unfortunately that isn't the case for everyone. In San Mateo County, the percentage of residents under age 65 that did not have access to health care was 6%, which is equivalent to 36,880 residents, or 6% of its whole population. When residents lack health insurance, it is more likely that they will not receive routine checkups that detect medical problems early on when they are more manageable. California's medical program provides its low-income residents with access to health care. After Congress passed the Affordable Care Act in 2010, eligibility for low-income adults expanded. Because of this, the program has seen an increase of about 5.6 million enrollees from 2014 to 2017. In San Mateo, they have the COHS plan. It is called the Health Plan of San Mateo and is currently run by the county. It is the only plan that all of their medical recipients fall under. Medical provides them with health centers, primary and specialty care physicians, skilled nursing and home health agencies, labs, behavioral practitioners, and regional hospitals and medical centers. In 2008, San Mateo County hospitals reached 35.9% of its hospital intensity use. 5 hospitals serve this county. They are Kaiser Permanente, not-for-profit; Mills Peninsula Health Services, also not-for-profit; San Mateo Medical Center, which is a public hospital; Sequoia Hospital, another non-for-profit community hospital; and lastly, Seton Medical Center, which is the only private hospital in the county. There are approximately 1.54 beds per 1,000 residents, 3.52 nurses, and 0.597 primary care physicians per 1,000 residents as well. Within this county, there are a total of 13 clinics. 4 of them are federally qualified health center sites, while the other 9 are community clinics, Indian health centers, or other free sites. They serve 47,782 patients, who are roughly 6% of the entire population. Over half of the population serve reports that they are Hispanic, and English isn't their primary language, which may make them a minority. The 2 races predominantly served are white by 48% and Asian Pacific Islander at 26%. There are multiple public health and mental services offered by the County of San Mateo. Some of these include the Child Health and Disability Prevention Program, which offers free health screenings to detect any possible signs of disability before it becomes a big issue. Behavioral services include interventions and recovery services. As for mental health, they have a 24/7 hotline and a crisis text line. San Mateo is also part of the group of counties known as provider counties that operate public hospitals and provide county-sponsored indigent care. All these efforts aim to improve the residents' quality of life by treating mental health and chronic conditions. One other factor that can have an impact on health outcomes is food insecurity. The U.S. Department of Agriculture defines food insecurity as a lack of consistent access to enough food for an active, healthy life. Food insecurity affects 49,000 residents, or about 40% of all individuals of low-income households. Some programs available to residents of San Mateo to prevent food insecurity include the WIC program, which stands for Women, Infants, and Children. This program, for low-income pregnant women and children up to age of 5, helps provide nutritious food supplies. It also provides breastfeeding help, and it provides mothers with food preparation and education and other local resource referrals as well. Although programs like this are available, it is essential to make residents in need aware that these resources are available. A significant health concern found in the county of San Mateo is diabetes and adult obesity. 21% of residents are affected by this. That's still lower than the average when compared to the state, but it is the only area in which they are not significantly lower and catching up to other counties. According to the Diabetes Association, the most common form of diabetes is type 2, meaning the body does not utilize insulin properly. The county reports that although 100% of residents have access to exercise opportunities, 16% of the population is still physically inactive. Adult obesity can increase the risk of diabetes because the more weight an adult has, the more resistant muscle and tissue cells will become to their insulin hormones. Some solutions to reduce the incidence of diabetes in San Mateo County include having community gardens. Planting these gardens builds emphasis on healthy eating by having residents participate in the growth of their fruits and vegetables. At the same time, it gets individuals physically active as they participate in gardening. Another option could be having health screening fairs. Health fairs would help residents recognize obesity, high sugar levels, or diabetes itself so that they can receive the appropriate treatment or care at an early stage. A third solution could include healthy weight campaigns, such as the Obesity Action Coalition's Your Weight Matters campaign, that provides weight loss options, tips on nutrition and fitness, and helps individuals understand their BMI. Some recommendations include that in order to make all the solutions listed above a reality, then funding needs to be attained to support the programs. Some ways to obtain this funding could include taxing fast food industries or junk food products to provide additional revenue for good weight campaigns, while at the same time discouraging residents from consuming these products. A smaller step could be to make diabetes awareness marathons, just as the March of Dimes does to raise funds for congenital disability prevention, and through the marathon raise funds for the diabetes prevention tactics. Overall, San Mateo County appears to be in good health, ranking second out of 58 counties, but still needs to reduce its incidence of diabetes and obesity. If the government and local organizations, along with policymakers and stakeholders, work together to create effective prevention programs for diabetes and obesity, they can improve residents' health outcomes.